Guidance related to these rules will be updated on the What is up, guys? Welcome back to my channel, the channel where we keep things real. I've got exciting news for you today. On the 24th of January 2022, the government made a statement and they gave us an update on this skilled worker visa for the healthcare assistant, home care workers and social care workers. They have actually released a date when this is going to be put into effect, and they've added a few more things on the eligibility criteria which you are going to love. And it gets more exciting, guys. It's not only the hospitals and care homes who are going to be recruiting the healthcare staff. Do you know who else is going to be recruiting the healthcare staff? You'll find out more in the video. If you are new to my channel, my name is Pauline Moyo. Popo Case is my name. Keeping it real is how I roll. I don't sugarcoat. And for the returning subscribers, thank you so much, guys, for all your love and support. I really appreciate it. For now, let's get into it.
Alright, they asking for the queen. I'm a bad bitch, she's a savage. Look back while I twerk. No comparison. I'm a savage, yeah. Classy, bougie, ratchet, yeah. Sassy, moody, nasty, yeah. Acting stupid, what was happening? What was happening? I'm a savage.
Disclaimer, I'm not an immigration officer. I'm just your eyes and your ears. If I hear anything new which I feel is going to benefit you guys, I just come and share it with you. And all I ask from you is to smash that subscribe button and hit the notification bell so that you don't miss any of my updates. And the good news is that it's free. Now let's get to the gist of the matter. Like I mentioned in my previous video, the skilled worker visa is from an applicant who has a job offer here in the UK, and it has to be from an employer who is approved of sponsoring this visa. However, the statement released states that lower salary requirement and application fee apply if the job is not on the shortage occupation list. So what does this mean? Remember, I said the salary threshold for this health and care visa is supposed to be £20,400. But if a sponsoring company is not able to pay you £20,400 per annum, or the salary that they are offering you is slightly lower, which means if a sponsoring company is not able to meet the £20,400 threshold, they can still bring you to UK, but application fees will apply. So this is good news because it simply means that even if the companies don't meet the eligibility criteria for sponsoring you to come to UK, like the £20,400 threshold, they can still bring you to UK and pay the application fees. So that's very good news, guys. What is the key existing requirement for the skilled worker visa? The job offer must be one which involves duties and responsibilities involving skills equivalent to RQF level 3. So RQF level 3 here in UK, guys, is equivalent to A level, or what they refer to as the Scottish Higher. So according to this statement released, applicants do not need to have a formal qualification. Yes, you heard me right. Applicants do not need to have a formal qualification. It is the skill level of the job they'll be doing which determines whether the threshold is met. These changes display the skills threshold for the care workers, which enables them to qualify for this visa route. These changes are aimed at alleviating the pressure due to COVID, because the health and social care are under pressure because of COVID-19. I don't know if there's still COVID-19 or it's now COVID-22. There's so much pressure in the healthcare system because of COVID. That's why they've relaxed these rules so that more and more people can come into UK to alleviate that pressure. This is what the government statement said, but in my opinion, you'll be at an added advantage if you've got a qualification. Remember, in my previous video, I said that some recruitment agents said that they need an SA certificate, they need this qualification and so forth. So this is what the government is saying. There is no formal qualification needed. But in my opinion, because I'm entitled to my opinion, if you have some form of qualification, you'll be at an added advantage. So because we're looking at a situation whereby I'm the employer, there's someone here who only has A level and has practiced some form of caring. And then there's someone here with a primary care nurse certificate and has been working as a primary care nurse for 7 years. I will obviously choose the primary care nurse because they have gained so much knowledge in the health and care system. They know how to care for residents and things like that, compared to someone who just has A level and maybe has 2 months caring experience. That's just my opinion, and I'm entitled to my opinion. Sponsors offering jobs in the shortage occupation list should offer people a salary of at least equal to whichever is highest, 20,400 per annum, or at least £10.10 an hour. So that is still the eligibility criteria. Like I've already mentioned that if you don't meet the eligibility criteria, the recruiting company will be made to pay application fees. Another thing, they said in line with care-related occupations, you have to provide a criminal record. So you provide a criminal record from any country where you have stayed for more than 12 months. So they look at your criminal record for the past 10 years. So if you have lived in any country other than your country, for example, let's say if I'm from Nigeria, if I'm in Nigeria, I have to provide the criminal record for Nigeria. And if I've lived in any other country for more than 12 months, maybe I've lived in Ghana for 12 months, I've lived in South Africa for 12 months, I've lived in Nepal for 12 months, I have to provide criminal records for all those countries, as long as I have lived for 12 months in those countries. So a criminal record is mandatory. It is also stated that these changes are not designed to offer home carers to sponsor a skilled worker unless they are working for a certain organization which is able to meet the sponsorship requirements. So this means that even if you have an elderly person to be cared for at home, you cannot as an individual offer a skilled worker to come to UK, because I know the temptation will be to offer our relatives the skilled visa so that they come and join us in UK. So if you are an individual, you are not allowed to sponsor a skilled worker. Guidance related to these rules will be updated on the 15th of February 2022 after Valentine's Day. Do you have a Valentine's Day? So that's when it's going to be effected. And some more good news, the following are also going to be able to sponsor this health and care visa. Let me read the statement. The impact on business, charities, or voluntary bodies is positive, and these organizations will be able to sponsor care workers where they have previously been unable to. So which means charities or voluntary bodies are now able to sponsor visas. So guys, it's only a few weeks before the 15th of February 2022. Are you ready to come to UK? So I'm going to come and give you some more updates. Remember, I'm your eyes and your ears. So make sure that you subscribe and hit that notification bell, and make sure that you turn on the all icon so that you don't miss any of my videos. Thank you so much for watching, guys. Thank you so much for your love and support. I will see you in my next video.